Women entrepreneur is a woman or a group of women who initiate, organize, or run a business concern. Despite women overpowering in sheer numbers, we still have very few women entrepreneurs in our country. There are only 7 women entrepreneurs in every 100 Indian entrepreneurs. The one sector where women leadership in business is eminent is in the micro, small, and medium enterprises, that is MSME sector. Of all the 63 million MSMEs, around 8 million are women-led, but things are changing for the better. Due to economic progress, better access to education, urbanization, spread of liberal and democratic culture, and recognition by society, there has been a spurt in women entrepreneurship in India. Women-owned businesses, enterprises are playing a prominent role in society, inspiring others and generating more employment opportunities in the country. The increasing presence of women as entrepreneurs is bringing a lot of change in business and economic growth of country. Gradually, but steadily, world over, women entrepreneurs have emerged as successful entrepreneurs. We at Medicircle are conducting the Top Women Entrepreneurs of Healthcare series to showcase such inspirational female role models on a revolutionary journey. Hello, I'm Aprajita Mehra, and today our guest for the talk is Anjali Mittal. Graduated from King's College London, Anjali Mittal is the founder and CEO of KRM Healthcare Mumbai. Home healthcare is a budding industry worldwide amidst the COVID-19 pandemic. With a strong passion for healthcare infrastructure development in India, she decided to build a platform which serviced a patient with end-to-end medical needs. With a full panel of specialized doctors, nutritionists, trained nurses, and attendants, and a pharmacy on call at all times, KRM Healthcare wishes to revolutionize the home healthcare sector and provide all services at a patient's doorstep. KRM Healthcare provides specialized senior care and COVID packages and has incorporated pathology and radiology home investigations. It is our privilege to welcome Anjali today to Medicircle. Medicircle. Hi, how are you, ma'am?
I'm good. How are you?
I'm doing good too. Thank you so much. So quickly, shall I embark on the journey of this interview?
Sure, go ahead.
Okay, so my first question to you would be, what is your contribution towards the healthcare industry as an entrepreneur?
So in the healthcare industry, from what I had seen in my time and day, is mainly the people, especially the paramedical staff of India, which is the nurses, the attendants, those kind of phlebotomists that we talk about, they're not given the right kind of training. And especially in the home healthcare industry, it was a common myth that, nurses who can't get jobs anywhere else, they join the home healthcare sector or something like that. So I wanted to make sure that the people that I send in to do the jobs that are very, very important, means home healthcare is more important because you don't have a doctor on call, in a hospital, you have a doctor on call all the time.
Absolutely.
So training was very essential. In this sector, I want trained people to go into the field and to look after the patients as your own. And that I consider to be my main, let's say, a small endeavor in the development of healthcare industry in India, where training can be given to paramedical staff, essentially.
Entrepreneurship has its own struggles, Anjali, and being a women entrepreneur adds to it. So, what do you think are the advantages of being a woman entrepreneur? I would like your take on that.
So I'll tell you specifically in the sector I'm in, which is home healthcare. A huge majority of my workforce is female nurses and female attendants. And that I say because a female nurse can, do an ECG, for example, for a male patient, but a male nurse won't be able to do a ECG for a female patient. So my majority of my workforce is female. And being a female myself helps me to understand their issues when we talk about home healthcare. Means you have to go to a patient at 11 o'clock at night, sometimes when, there is an urgent call made. And sometimes you have to go to patients' houses where they are completely alone, and
Absolutely.
security is not a very big agenda for the other home healthcare players that I look at. Means I've heard that from my staff,
Mhm.
and that is something that I can understand, and I can relate to with my workforce. And that is something I think that has helped me build a better workforce, where even the workforce, if they don't have trust on you, they can't deliver their best possible jobs, and they need to feel secure. They shouldn't feel insecure in their jobs when they are basically doing life saving jobs. So that is something that has really helped me in this sector specifically, to
Mhm.
understand the needs better of my workforce, and as well as my patients as well. Means I'm not a doctor, but I consider every patient of mine as a personal patient, because I have to look into it personally. So that has been a very big advantage of being a woman in this particular sector.
Oh, how lovely is that? So, my last question to you would be, what has been the biggest challenge and the biggest motivation also in your journey, Anjali?
I think the biggest challenge has specifically been, as I would say, the training of the staff. Because when I did get the staff, I saw that they were very untrained, and I couldn't send them out into the field. I think that was the biggest challenge, where that is something I want to actively work on, as in when KRM healthcare grows, and work closely with the medical sector and the healthcare sector of India, where we do put in a lot of resources to train our doctors, but we need to train our paramedical staff. We need to train, means there is a person coming to take your blood, to your house, but if the training is not correct, they can rupture a vein, and
Yes.
or they can't find a vein sometimes, and that training needs to be given to them. And it's not just medical training,
Mm-hmm.
but their social etiquettes, how they present themselves, what kind of growth can be had.
Yes.
And that was my biggest challenge in this sector specifically. And also what I said, ensuring my staff's safety, and
Mm-hmm.
sometimes ensuring even the patient's safety. Um what experienced nurse or anything should go into a specific case.
Right.
So I think that was the biggest challenge in this sector that I faced. The biggest motivation was actually personal. In the recent
Okay.
COVID times,
Uh-huh.
in COVID times, I did face a lot of people personally in my house that felt sick, which was non-COVID related, but they refused to go to the hospital. Means they got dengue, they got chikungunya, they got other types of diseases. They got a fracture and they needed to go to the hospital, and they refused to
Right.
do so because
Oh
they were
my
scared of
God.
COVID, even for non-COVID hospitals.
Uh-huh.
And I thought that it is so important to address this, where if we can build a home healthcare sector where people are comfortable. Okay, I don't want to, and COVID is something that is here to stay clearly, as we are seeing. So we need to adapt our lifestyles to COVID, and that's why I think home healthcare is so important right now, where we are not a run-of-the-mill home healthcare sector where we are just sending you staff, but we are making sure all your investigations are done, all your consults, your doctor consults are happening at your home. We even are sending you medications and surgicals, like sometimes you need multivitamin shots, or some kind of an injectable, but it's not available at your regular pharmacy. You can request that, and we'll
Uh-huh.
send it to you. So we are trying to do a end-to-end patient need,
Wow.
at the patient's doorstep. Also, so this is a personal motivation where patients can be comfortable. And right now we're only in Maharashtra, but I aim to be in every nook and corner of India where healthcare is so important. So I want healthcare to be accessible to all, not just and everybody deserves private healthcare. It's not just public healthcare that should be given to all. Private healthcare is something that's important to everybody, and I think that is what we will focus on in the future.
Wow, I enjoyed your answer in the to the extent where you said you train your staff so well, like you are actually enhancing their skills. You're trying to groom them beyond the work that they are, required to do. The service that is required of them. So that I
That
found
is
very
very
interesting.
essential, because if you go to any other job, there is a
Uh-huh.
training curve attached. Even a normal nurse, if she goes into a hospital or a clinic, there'll be
Mm-hmm.
a 1 month, 2 month training time given to her. But
Absolutely.
not in a home healthcare sector in general. That is what
Yes.
I've seen from the other
Uh-huh.
home healthcare
Sure,
players.
sure.
And we make sure that we have our head nurses who arrange training camps. We are also talking to UGC to get some certified courses enrolled with our organization, so that all our staff means, have you ever, if you've ever been in an ambulance, you will actually know that the people in the ambulance boys are not trained in India. But
Yes.
because I stayed in UK for 5 years, I
Mm-hmm.
know that paramedical staff training is actually very essential there, which does not happen in India. So that is what I'm also trying to kind of incorporate.
More than that, I've realized, Anjali, that people skill is something which is lacking in any sector here. And
Of course.
while you are working on it, it is really, really commendable step that you have, pointed out a flaw that we all have, and you're trying to bridge that gap also. So that
Means
is
I'll
really
tell you a
exemplary.
small example. I
Uh-huh.
had a very, very I would say capable attendant that went to a patient's house.
Mm-hmm.
But because she couldn't talk properly in English, the patient's family said no to her. And and the way she looked, and
That's
it is
really
a worldwide
sad. But
phenomenon.
that's really
Yeah,
sad.
it's a worldwide
Your
phenomenon that
knowledge of
done.
language does not define who you are as a skilled,
Or
uh,
even the way they looked means I can understand hygiene, but just
uh,
because she's wearing a sari means she's not going to wear a sabyasachi sari, she's going to wear whatever she can afford.
of
and
course.
and they're like, sorry, we won't, we need you to send another attendant. And that's when, to bridge that gap, I decided that all my staff, regardless of nurse or attendants, they'll be
Mm-hmm.
wearing lab coats over their clothes. And
Mm-hmm.
that just adds an extra level of hygiene. And then, I can also train my staff to, what they have to say, how do they have to present themselves, those
Mm-hmm.
basic etiquettes that nobody teaches them. You and me, coming from the backgrounds we come from, we have
Absolutely.
that social
We
basic
have that
etiquette, but
edge, of
nobody,
course. Yes, we've had that kind of
yeah, and
grooming.
nobody takes the time to teach these people who are basically, means we can't do what they do. They are saving our lives in a lot of ways. A doctor
So
will tell
true.
the nurse,
So true.
nurse, start the IV, nurse, start
Uh-huh.
the IV. The nurse is actually doing that. Yeah, the doctor takes the call, but the nurse is actually, her hands are actually doing that thing. So I think that is very important, where I truly believe that anything has to be a win-win-win situation, especially as a female entrepreneur. If nobody believed in my skills because I was a woman at, when I started my career, I
Mm-hmm.
wouldn't have come to this, this
This far,
kind
of
of
course.
position
Yes.
and am in. And that is what I truly want these people to do, that they need to be given all the access to the best possible training we can give them. So not only they just do their jobs, or it's not just that they're doing their jobs, but they're enjoying to do their job and they're getting something out of it.
Yeah,
There is still a learning curve for them.
absolutely. Owning your own work and, taking pride in that is very essential and crucial
Of
for
course.
any kind of jobs. So,
And you're
Anjali,
never too old to stop learning.
absolutely. That is one thing we should, adhere to. Thank you so much, Anjali. It was amazing talking to you. You have been so what should I say, more approachable. You have been so open about your answers. So thank you for sharing your valuable time and all your insights with us at Medicircle. It was really a pleasure having you today. Thank you so much. An
Pleasure was
empowerment
all
woman
mine.
who's
Thank
trying to
you.
empower others. You actually are a role model. It was really
Thank you so
lovely
much.
meeting you. Thank
Thank you.
you.
Thank you. Bye bye.
Bye.